تبریک جهانی به سخت‌کوشی درمانگران ایرانی. رئیس هیئت اعزامی سازمان جهانی بهداشت از تلاش خستگی ناپذیر کادر پزشکی ایران برای شکست دادن ویروس کرونا ابراز شگفتی کرده و گفته به شما افتخار می‌کنیم و این سخت‌کوشی رو تبریک میگیم. ریچارد برنان در نشست خبری دبیر ستاد ملی مقابله با کرونا این رو هم گفته که ایران یکی از قوی‌ترین سیستم‌های بهداشتی رو در شرق خاورمیانه داره و با توجه به شیوع بسیار بالای ویروس کرونا ایران پیشرفت‌های خوبی داشته و بقیه کشورها در منطقه و دنیا میتونن از تجربه ایران استفاده کنن.
Today, the WHO mission visited one hospital in Tehran dealing with coronavirus patients. How many hospitals have you visited, and how would you characterize the way that the outbreak is being managed in Iran?
I have visited, meanwhile, a number of hospitals, not only in Tehran, but also in other provinces. The hospital we have visited today was the mission. Briefly to the mission, we have a big WHO mission, which is also supported by the Robert Koch Institute from Berlin, and we have also experts from China in the mission to learn from the experiences there. This mission has visited today tertiary level facilities, and they were very impressed with the quality of services there, and also with the critical thinking which is needed in the moment really to increase the cycle of improvements and learning. And we saw also PhD level facilities, which is quite interesting, because when you really want to deal with the early case detection and the contact tracing and the stopping the transmission route, the referral from PhD primary healthcare level to tertiary level is very important. So Iran has a very strong PhD system, and the mission was very impressed also by the PhD facility they could see.
Do you believe that Iran has that capacity? I understand that you're saying there's been an upscaling of efforts to try and contain the virus from spreading in Iran, but do you believe that Iran is able to do that, or is this a situation that you're concerned about spreading widely?
I think what most people do not know maybe from Iran, Iran has one of the strongest primary healthcare systems in our region, in the Eastern Mediterranean region, and has, before the epidemic started, been in many areas, the health system has been in many areas a best practice example for many other countries. For example, when you see the discussion, global discussion on universal health coverage, Iran is one of the countries with the highest coverage of financial protection in our region. So the country starts the epidemic with a real strong health system. That I'm talking about upscaling means when you now have suddenly such an epidemic, it means for every system you need to upscale. You need to upscale, and you also need to introduce innovations, and you need to do it in evidence-based way. And that is why we as WHO try to support, like any other member state, try to support Iran in providing that international network and international expertise, which you will appreciate is in the current political context not that easy.